I'm David Clarke. I am a New Zealander. I work for WHO in Geneva. And today we're going to have a conversation about the role of the private sector in health, and particularly the role of the private sector in delivering public health benefits. And we're really lucky today to have with us Barbara O'Hanlon, who has been one of the preeminent experts in this area for many, many years now. So over to Barbara to introduce herself.
Thank you, David. And I'm delighted to have the chance to talk about a subject that you and I like very much, which is how to engage the private sector. And I have been working in possibly far too many years on this subject. I've been working as a policy advisor on several different public health issues for upwards of 30 years. And in the last 17 years, I have been focusing on building government capacity to engage and steward the private health sector, mostly in low and middle income countries.
Yeah. I think I first met you in 2015 at a meeting in Cairo. And we keep, yeah, so it's been a while now.
That's right. Yeah. That's right. Yes.
Yeah. So over the last 2 years, really, you've been working with us as part of our expert group on the private sector. And more recently, you've been directly supporting our work on helping member states work with the private sector as part of the COVID-19 response. What challenges have you learned from the work on the COVID response in relation to private sector engagement? Maybe starting off with the challenges that governments are facing.
Yeah, that's a good question, because indeed governments are facing double challenge. One is they're trying to get organized and structured just to respond immediately to COVID. And then the second challenge is how do I get the private sector involved and aligned with what we need to do for COVID? And some of the more immediate challenges they're finding under private sector engagement is, number one, they don't know who in the private sector is out there and what they're doing. So there's a big gap in data. Another challenge is, quite frankly, there's a lot of mistrust still of working with the private sector. And this stems primarily from their uncertainty of the quality that the private sector can deliver. So they're a bit reluctant to think about the private sector as a partner. And then a more practical challenge is what we're finding as they're rolling out the new guidelines for various aspects of COVID, that they're writing them for public providers. And as a result, private sector providers are not often authorized to do some of the basic functions. So those are, off the top of my head, some of the government challenges.
And do you think they're new challenges, or do you think they're challenges that have been around for a while and they're just being exacerbated by COVID?
I think that they are common challenges, no matter what the health issue, whether it's a health area or a system area. With COVID, though, what's happening is it's shining a bright light on these challenges.
Okay. Yeah. And I guess we can't just look at one side of the picture. Obviously, the private sector has been also affected by the COVID response. And we know that there's been it's a real mixed response from the private sector. We do hear stories of bad private sector practice in many countries, overcharging for services. But we also hear stories of the private sector themselves wanting to contribute in a constructive way to the response. What sorts of challenges do you think the private sector are facing in this environment?
Yes, and as a matter of fact, they're facing challenges both as a healthcare provider that wants to treat patients, as well as a healthcare business. On the provider or service delivery side, private sector often finds themselves locked out of any strategy discussions at the government level on how to respond to the pandemic. As a result, many private providers and facilities are operating under uncertainty with no clear guidance on whether or not they can participate in the COVID response, if they are authorized to participate in the response. There's been very little information exchange between the government and the private sector on basic things like clinical protocols and treatment criteria, things like that. And even if they are authorized to participate in one of the aspects of COVID response, they don't benefit from any of the training that's been going on within the public sector. Um, on the business side, like everybody else, they are experiencing extreme disruptions in supply. So even if they want to deliver, they can't access many of the inputs that they need. But what we're finding through the research is that because of these lockdowns, there's not enough foot traffic. And so they're now having to lay off staff, do drastic cost-cutting measures, and in many instances, close their facilities, hopefully temporarily. But we're starting to see with great concern that the private sector may not be around post-COVID if something's not done to address the business side of it.
Why is that a problem?
Well, it's a problem in the short term in the sense that to address COVID, we need all hands on deck. I mean, we need public, private, civil society to all march in the same direction. And, the private sector has a lot of resources, both in infrastructure and staff and expertise. But even in the short term and in the midterm, a lot of the health services that we care about are suffering. Yeah. We're starting to see backsliding in a lot of the achievements that many of the countries have been able to gain in the last 5 years. And the private sector has been part of that success. And if they're not around, what does that mean more long-term for some of these health indicators?
Right. So do you think we're at a bit of a turning point? Has the whole COVID crisis generated a bit of a pivot point for health systems and the role of the private sector, do you think?
Despite it being a crisis, I also think it's an opportunity. And what we're starting to see, just as you had mentioned before, is the private sector has really come to the table in a big way. We see both private industry contributing enormous amounts of money to help subsidize the cost to respond to COVID, both in terms of the medical response, but also, the social determinants or the secondary effects of COVID. And then we're also seeing that a lot of the private sector facilities and providers are, aggressively or actively trying to partner with the government to work on COVID. The other thing that's happening on the private sector side is it's starting to unite them. Private sector is historically been very diverse. I sit in my corner doing pharma, you sit in your corner doing service delivery. Well, now they're coming together and say, no, this has to work as one to address. So that's another good thing. The other thing is they're starting to realize that they need to find local solutions. In the region that I work in, Africa, you start to hear this phrase a lot, Africa's solutions for African problems. So they're starting to look internally on how the private sector can do some of the things that normally they buy or purchase or import.
Yeah.
And then on the public sector side, I think it's only made it more acute, the recognition that they can't do it alone. And so what I'm starting to see is governments are accelerating their approachment to the private sector, whereas before they might have waited around, now they don't have time. So they're being driven together quickly.
Okay. So what can we do? Because it sounds like there's some very positive elements that are coming out of the negative. What do you think we can do in the medium term and the longer term to maintain this momentum of bringing the public and private sector together? What sort of things do you think we need to do to sustain this momentum?
Yeah. Well, I think the first thing is I'd like to applaud WHO's leadership in this area. And I think it's very timely that now private sector engagement has become one of the core or priority areas under the HSG collaborative. And I think it really gives governments the comfort that in fact they can be working with the private sector, but they need more than that. They need tools. And so some of the work that the private sector engagement team are doing in the areas of how to better dialogue and interact with the private sector to come up with a common vision on where to go and how to do it together, how to contract private sector quickly under suboptimal conditions, even the work on giving guidance and criteria on what type of economic and financial policies governments can do to help ensure that there is a private sector after COVID. I think these are all good tools that governments can use to address some of the challenges that we've been talking about.
Right. Where do you think, what do you think the private sector is going to look like in 5 years' time? Do you think we're looking at a complete change in the way that health systems are integrated between public and private?
Well, so I see two scenarios, and let me share the bleak scenario, which I hope with some of the tools that WHO is offering, we can avoid. And the bleak scenario is that very little economic and financial support is given to the private sector, particularly small and medium enterprise level private sector that deliver the type of services that we care about.
Yep.
May go under, and then we'll start to see a consolidation in which all we have are the high-end private sector delivering to that small niche.
Right.
That we don't want.
No.
So on the positive side, if government does find ways to better dialogue, to better coordinate, to start finding formal mechanisms in which to engage, whether it be contracting, expanding benefits under national health insurance, or supply under these health insurance programs that include private provision of care, then what we may start to see is what you're saying is an integration of the two sectors working together to achieve national goals that everybody shares.
Right. Great. Well, thanks, Barbara. This has been a great conversation. I really appreciate you making this time for us so close to Christmas. And so thanks again.